Of course, houses of worship aren't the only major places reopening in our city. We go now to Maleeha Sheikh, who's been looking into concerns medical professionals have about daycares being allowed to reopen. Maleeha.
Melissa, Ontario childcare centres were given just a 3-day heads up this past Friday, letting them know that they would be allowed to reopen. We spoke to a pediatrics and infectious disease specialist who says no matter how good the policies are, that simply isn't enough time to implement them, which is why many centres are choosing to open up at a later date. But as a parent, if you are somebody who has to send your child to a childcare centre in the near future, here's what you need to know.
You have a whole bunch of little kids together, it's impossible to physically distance them. And so chances are in many of the daycares, once the kids start engaging with each other, kids are going to get infected. And if the kids get infected, then, they might bring that home and the parents might get infected. My concern is not necessarily that the kids, because most kids have mild symptoms, or even the parents, most of them will have milder symptoms, but it's just the vulnerable people at home.
According to Public Health Ontario, there have been no deaths recorded for those 19 and under. The majority of deaths are those who are 80 and over.
If you have someone at home then who's really sick or who's elderly or who's compromised, maybe now is not the time to send these kids to daycare.
Education Minister Stephen Lecce says operators will be required to limit the number of kids and staff to a defined space to 10 people. The rules will include increased cleaning, no visitors allowed in the center, screening all staff and children for symptoms prior to entry, enhanced cleaning before opening and throughout the day, and removal of toys that may spread the virus.
Little kids will play with each other. That's their nature. So you can't, you can say in paper, okay, hand sanitizer, washing your hands, not playing with these toys, but that's going to go out the window in a couple of days. All these kids are going to get infected. They risk to kids, they may get a cold or minor symptoms. Some of them get rashes. It's extremely rare for them to get very, very sick with this.
Dr. Anna Banerjee adds while kids aren't really the concern, them spreading it to vulnerable people and their families is. For those who have no choice but to send their children back, there are some positives.
It's going to be important to their development and for them for socializing. I think it's important for their mental health to be able to engage with other children.
While childcare centres have been given the green light to open up, Education Minister Stephen Lecce acknowledges that it'll take operators some time to learn the proper training, which could take some days.